Hi, we're here today with Richard.
Hello.
From the dentists,
The local dental committee of Doncaster.
And we're going to have an update on the dentist contract. Looking at the headlines like we did before and what it means in truth.
Okay.
So I've had a look, got a few questions here. One of the headlines is the dentists are going to return 900 million after failing to see NHS patients. Are you just all lazy and on a golf course or something?
No, I don't think it's quite like that, Fran. I think there's probably multiple reasons for what's in the system is called clawback. The way it works is that dentists have an annual contract for a certain amount of work. If that work's not done, then quite reasonably they don't get paid for it, and the money comes out of the practice budget and it's taken out over the following year over a 6-month period. 900 million represents the national figure, obviously. There's multiple reasons why that work doesn't get done. Staff shortages. So if you're in a practice where you can't get an associate to come and work, there'll be certain parts of the country where that's worse than others. So if you were in, let's say, Skegness in Lincolnshire, that might be a problem. Less so if you were in, I'll pick somewhere and say in the middle of Leeds. So the staff shortages, the shortages of dentists, there might be shortages of nurses as well, because a dentist can't work on his own. So if you've got staff shortages, that may in fact be a problem for the practice. One of the other things that has come in over recent times, dentistry's been not forgotten with technology. There's all kinds of things that you can do, digital scanners, 3D printers, CT scans, all of these things that massively improve the quality of treatment. But the costs of providing that treatment are vastly more than anybody would get paid on the NHS. So you might have a crown that just fits like a dream, but the cost of actually producing that for you will be more than dentists will get paid on the NHS. There's also a drive towards a lot more cosmetic dentistry. A lot of this is fueled by social media. So when I was a lad doing, let's say, orthodontics, where you're moving teeth around with braces, when people got to about the age of 16, if they hadn't had it done, so sorry, you've missed the boat. That's not the case anymore. The technology that exists, lots of adults having braces to move teeth around. There's a regime called ABC, Align, Bleach and Contour. So you have a brace to start with, and then you bleach teeth, and then you add little bits of composite here and there to make teeth just so perfect. Well, whilst dentists are doing that, which the public are interested in, obviously, and it no doubt is very professionally satisfying to change smiles and transform people's lives, all the time you're doing that, you're not doing normal NHS dentistry, so that's a factor as well. Over probably the last 20 years or so, there's a lot more women work in dentistry as dentists than probably when I was a lad, and that's great. Women are more people-centred, more compassionate, more caring than men are. But it's well known that women work a lot more part-time, especially during the family years, than men do. And so within and there's a lot of men in dentistry not working full-time either. So there's a lot of part-time work that a generation back might have been full-time. So there's lots of reasons why that NHS budget is not getting spent. It isn't just because dentists are lazy.
Or playing golf.
So there.
Right. Okay, the other thing, the headline, urgent care. NHS dentists are required to deliver a minimum level of urgent care. What's this mean? So
this is coming in tomorrow, 1st of April. Some of these changes that we're going to discuss are from tomorrow. And so dentists, as I've said already, have a contract. That's now been split into a core contract and an urgent care contract. The urgent care is 8.2% of their overall contract. Claims are submitted and have been for years, computerised down to the Business Services Authority down in Eastbourne, and there's codes for different types of treatments. All these things can be tracked through the system. And so from April the 1st, 8.2%, it roughly works out to one urgent course of treatment a day. Now, these things can be done on your existing patients, your existing patient base, or you can take on new patients to facilitate new patients. Quite how it will all work out in practice, I think we've got to run the experiment and see. If dentists could easily meet their targets within their own patient base, they won't be looking to take any more patients on. But if they couldn't, then they probably will. So hopefully over the course of a year, the new regime will get monitored, and you'll be able to see whether it produces any extra appointments for people that currently can't get them. If dentists don't do the 8.2% on the urgent care, let's say you do 5%, that 3% gets clawed back, as I've mentioned, clawback already. However, if you overperform on the 8.2, let's say you do 12, that can be counted off your core contract. There's no more money in any of this. There's no new money. This is all shuffling the targets in a different way. So it may produce more access for people that don't already have a dentist, but we'll only really know when you get to the end of the year and people look at what's actually happened.
Because I like to change how I've got my questions written down. Question there, you mentioned that the urgent care might go to their patients. Question, anything within this contract gives more hope of me being able to find an NHS dentist?
Yes, well, if you were to take on more urgents, that's one thing. But you have to appreciate that whilst you're spending more time doing urgent things that might be extractions, lost fillings, infections, what have you, that's less time for routine care. However, as part of this new system coming, dentists have the option to take part in clinical audit, and one of the audits that the system would like to see is checkup intervals. So at the minute, NICE guidelines, National Institute of Clinical Excellence guidelines, are anywhere between 3 months to 2 years, depending on what you and that patient feel between you that you need. This audit is likely to want to drive checkups a year, maybe 2 years, with the aim of less routine care, so you might then be in a position to take more patients on to your books or do more urgent care. Now, whether patients that are used to coming yearly are going to be happy, well, we can't see you yearly now, we're seeing you 2 yearly, remains to be seen. That's obviously some conversations that are going to need to take place. But I'd also point out that there's a finite number of patients that any practice can take on, because you've got a limited budget. You've got this budget set by the NHS. So it's no good just emptying appointment books and saying take more and more and more and more on, because if your budget, let's say, reasonably looks after 2,500 people, and then you keep jiggling things and all of a sudden you've got 4,000 people, well, that's a lot more teeth to break and toothaches to have, and so there's a limit to the number of extra people that a practice will be able to take on.
Okay. All of these contracts and neighbourhood health has all been about preventative. It's better than cure. Mm-hmm. And there are some points in this contract that I've read that it's got a preventative focus. Mm-hmm. Go on.
Well, never more so. In prevention better than cure is absolutely it in dentistry. If you don't start with decay when you're a child, you don't end up having the restorations, the fillings, the crowns, whatever, that all go wrong in later life. I'm 65, I haven't had tooth decay since I was 17, but all the work I've had done over the last 50 years is all because between 6 and 17 I had fillings and things ultimately then go wrong. So prevention is huge. So for the first time, dentists are going to get paid to, when I say paid, remember there's no more money, this is just units of dental activity coming off your core contract. But in effect, you're going to get paid for putting fissure sealants on teeth. Now, these are little coatings that go on the surface, the biting surface of usually molar teeth at the back, because that's one area that is prone to decay. So if you can stop that from age 6 onwards, when these back teeth start coming through, that's a huge plus, that's a huge bonus. Dental nurses are going to be allowed to apply fluoride varnish, get paid for applying fluoride varnish in between checkups on children's teeth, and it's known that high concentration fluoride varnish does reduce the decay rate in children. So introducing that and getting credit for that in the system for the first time ever is a positive. The other thing that was being mentioned has been toothbrushing clubs in schools. So again, if you get children into good habits early on, Doncaster Council have been really good at this anyway, but there is some more capacity being brought on into, I forget what it is, but let's say another 10, 15 institutions, schools, where children are being shown how to brush their teeth and looking after the teeth as an important part of looking after themselves. So the prevention element of these changes from April the 1st is really positive.
So it sounds like there are some positives, but it's going to be, let's see what actually happens 6 months down the line, how it plays out.
Yeah, I mean, I think overall, if I was to sum up the changes that are coming in on April the 1st, there will be some more, but this I think needs legislation, but there will be some more in June, which we may or may talk about, may or may not talk about. But yeah, I think the changes that are coming in tomorrow are overall a positive thing. So,
where does this leave dentists? Bottom line, where is it? What's going to happen with dentists out there?
Well, I mean, if you look at the overall dental budget in 2026, it's about 3.3 billion. A lot of that comes from patients' charges, because forget the free at the point of delivery. If you've got a certain level of wealth in this country, you're paying patients' charges. And there's something like 900 million comes from patients' charges. So the government currently spends about 2.3 billion. The budget was very similar in 2007.
Almost 20 years ago.
Almost 20 years ago, the budget has very little changed. And although you're saying, well, dentists aren't spending the 900 million, we've given reasons why that is the case. During that time, we keep hearing about an ageing population. That's true in dentistry, in as much as you've got people that when I was a kid, when I was 23, starting out dentistry, somebody of my age, 65, wouldn't have any teeth. The demands that they put on the service were like a new set of dentures once a decade, say, and that's about an hour of clinical time, give or take. Those same people now might take 2-3 hours a year. So you've got people that are needing more looking after because we've been successful in patients retaining the teeth. But of course, they were all in the just like I was, prevention era, so we've all got restorations that need looking after. There's also roughly about 8 million more people here, so you've got more people, more mouths, more maintenance on the same budget. So what does that tell you?
So dentistry isn't going to necessarily get a lot better until somebody turns it on its head?
I think that's a fair assumption. I think I could agree with that.
Well, maybe in a few months' time, when we roll this out, you can come back and we'll see how it's going.
I would come back and say that they are positive changes, but the experiment hasn't yet been run, and you'll be able to tell in a year's time when all the data's in as to what difference it's actually made.